Hello everyone. This video is about iron deficiency anemia, iron deficiency symptoms, and iron deficiency anemia treatments. Iron deficiency anemia is a common type of anemia in which blood lacks adequate healthy red blood cells. The red blood cells carry oxygen to the body's tissues. Iron deficiency anemia is due to insufficient iron. Without enough iron, body cannot produce enough hemoglobin. Hemoglobin is the part of red blood cells that gives it red color and enables the red blood cells to carry oxygenated blood throughout your body. As a result, iron deficiency anemia may leave you tired and short of breath. If you are not consuming enough iron, or if you are losing too much iron, your body cannot produce enough hemoglobin, and iron deficiency anemia will eventually develop. Initially, iron deficiency anemia can be so mild that it goes unnoticed. As the iron deficiency anemia worsens, the signs and symptoms intensify. The first symptom is you start feeling extremely fatigued and weak. More than 50% iron deficient people experience this symptom. You get tired because muscles cannot get enough oxygen to produce energy. Tiredness is common in this modern age. Therefore, it is difficult to diagnose iron deficiency with this symptom alone. The second symptom is your skin turns pale. Paleness in general or in specific areas such as face, nails, or eyelids may be a sign of moderate or severe iron deficiency. Pale coloring inside the lower eyelids is a very common sign of iron deficiency. It is one of the first things the doctors look for. The pale color is due to less red blood cells. And the third symptom is shortness of breath and fast heartbeat. Due to low oxygen levels, your lungs try to pump in more and more oxygen when you walk or do some other physical activity. This is also a common symptom of iron deficiency anemia. And sometimes you may also feel chest pain. And the fourth symptom is headache, dizziness, or lightheadedness. Headache coupled with lightheadedness and dizziness is another symptom. This is less common than other symptoms. And the fifth symptom is inflammation or soreness of your tongue. A sore and swollen tongue can be a sign of iron deficiency anemia. Cracks on the corners of the mouth can also be a sign. And the sixth symptom is restless legs syndrome. Iron deficiency is also one cause of restless legs syndrome. It causes a strong urge to move legs due to unpleasant sensations in the feet and legs. It worsens at night when you try to sleep and causes insomnia in many people. And the seventh symptom is heart palpitations. You feel like your heart is beating too hard or too fast, skipping a beat or fluttering. This symptom is less common. And the eighth symptom is brittle fingernails. Brittle nails is a less common symptom of iron deficiency. Some people feel cold hands and feet. Some people crave to eat unusual things such as ice, dirt, clay, chalk, paper, or starch. Most often, this occurs during pregnancy. And the 11th symptom is poor appetite, especially in iron deficient infants and children. This symptom is common. If you or your child develops signs and symptoms that suggest an iron deficiency anemia, see your doctor. Iron deficiency anemia is not something to self-diagnose or treat. So it is a good idea to see your doctor for a diagnosis rather than taking iron supplements on your own. Overloading the body with iron can be dangerous. Excess iron accumulation can damage your liver and causes other complications. So what actually causes iron deficiency anemia? The first cause is blood loss. When you lose blood, you also lose iron. Women with heavy periods are at risk of iron deficiency anemia. Internal bleeding from peptic ulcer, hernia, or colon cancer can also cause iron deficiency anemia. Gastrointestinal bleeding can result from regular use of some over-the-counter pain relievers, especially aspirin. And the second cause is iron deficient diet. Your body regularly gets iron from the foods you eat. If you consume too little iron, over time your body can become iron deficient. So consume iron-rich foods including meats, eggs, leafy green vegetables, and iron-fortified foods. For proper growth and development, infants and children need iron from their diets. And the third cause is inability to absorb iron. Due to some medical condition like celiac disease, iron is not absorbed from your small intestine. If part of your small intestine has been bypassed or removed surgically, that may also affect your ability to absorb iron and other nutrients. And the fourth reason is pregnancy. Pregnant women need more iron for the fetus and for themselves. Without iron supplementation, iron deficiency anemia is common in many pregnant women. Now let us see who is at risk of iron deficiency anemia. Number 1. Women in general are at greater risk of iron deficiency anemia due to menstruation and pregnancy. At number 2, infants and children are also at risk of iron deficiency anemia. Especially children, those who are born with low weight or born prematurely. And those who don't get enough iron from breast milk or formula may be at risk of iron deficiency. Children need extra iron for their growth. If your child is not eating a healthy diet, he or she may be at risk of anemia. Number 3. Vegetarians. Meat is the best source of iron, and vegetarians don't eat it. So vegetarians are at great risk if they don't eat other iron-rich foods. Number 4. Frequent blood donors. People who routinely donate blood may have an increased risk of iron deficiency anemia. Frequent blood donations can deplete iron stores. Low hemoglobin related to blood donation may be a temporary problem, and it can easily be overcome by eating iron-rich foods. Mild iron deficiency anemia usually does not cause any complications. However, left untreated, iron deficiency anemia can become severe and lead to severe health problems. Let us have a look at these possible complications. The first complication is heart problems like enlarged heart or heart failure. Iron deficiency anemia may lead to a rapid or irregular heartbeat. Your heart must pump more blood to compensate for the lack of oxygen carried in your blood when you are anemic. This can lead to an enlarged heart or heart failure. And the second complication can be the problems during pregnancy. Severe iron deficiency anemia is linked to premature births and low-weight babies. And the third complication is growth problems in infants and children. Severe iron deficiency can lead to anemia as well as delayed growth and development. Additionally, iron deficiency anemia is associated with an increased susceptibility to infections. So how can you prevent iron deficiency anemia? You can overcome this problem by eating iron-rich foods. Eat red meat, pork, poultry, and seafood. Eat beans, peas, and dark leafy green vegetables such as spinach. Eat dried food such as raisins and apricots. Consume iron-fortified cereals, breads, and pastas. Your body absorbs more iron from meat than it does from other sources. If you choose to not eat meat, increase your intake of other iron-rich plant-based foods. Vitamin C enhances the iron absorption. So also choose foods like citrus fruit, which is high in vitamin C. How to prevent iron deficiency anemia in infants? Feed them breast milk or iron fortified formula for the first year. Cow's milk is not a good source of iron for babies, and it is not recommended for infants under 1 year age. After the age of 6 months, start feeding your baby iron fortified cereals or pureed meats at least twice a day. After 1 year, be sure children don't drink more than 20 ounces of milk a day. Too much milk often takes the place of other foods, including those that are rich in iron. Thank you guys. Please like the video and share it with other friends. And subscribe to my channel. Thanks.